An assortment of approaches have been used in individual therapy with clients who use substances, including cognitive behavioral therapy, social skills therapy, behavior therapy, solution focused therapy, and aversion therapy. Cognitive behavioral therapy is a direct effect theory that is based on two forms of psychotherapy, combining cognitive therapy and behavioral therapy. Cognitive behavioral therapy is also known as a cost-effective treatment that examines the relationship between thoughts and feelings, having a direct result on the substance user's behavior. In order to reach the goal of changing behavior, the therapist has the substance user vividly recount the traumatic event and then give the homework to motivate changes in thoughts and feelings. It is stated that homework is the most important compliance measure for treatment to be successful. I definitely agree with the thought of giving patients homework, but I'm not sure about this, whether or not they will fulfill it. If the patients are not doing the homework they are assigned to, then it will not help the treatments carry on. The counselor is in charge of relaying the work and advice to the client, but it is solely up to them whether they want to comply and receive the proper treatment. Social skills therapy is a psychotherapy that works to help people improve their social skills so they can become more socially competent. It is mainly a behavioral therapy, but frequently cognitive therapy can also be used in some situations. This psychotherapy can be done on one or in a group situation. Social skills therapy is mainly used for individuals that are diagnosed with certain mental or psychological disorders and whose symptoms involve poor social functioning. Social anxiety and social phobia are two major disorders that social skills therapy accompanies. The amount of time needed to complete a social skills therapy program varies depending on how well you are learning the techniques and how much confidence you have in using the skills in a social environment. I believe the effectiveness of this specific therapy is only as strong as the client decides to make it. The time needed to complete such a program as this one is focused on how fast the client is learning the techniques and whether they are willing to apply it to their everyday life, which, if not, can result to certain drawbacks. Behavior therapy is a broad term for types of therapy that treat mental health disorders. This form of therapy seeks to identify and help change potentially self-destructive or unhealthy behaviors. It functions on the idea that all behaviors are learned and that unhealthy behaviors can be changed. Behavioral therapy can benefit with a wide range of disorders. People most commonly seek behavioral therapy to treat depression, anxiety, panic disorders, and anger issues. Behavioral therapy has successfully been used to treat a large number of conditions. This type of treatment is considered to be extremely effective and averages out to about 75% of the people who enter the cognitive behavioral therapy experience some sort of benefit from the treatment. Some drawbacks that could relate to this type of therapy could involve uncertainty of which type of route to take for which type of disorder due to the fact that it treats such a broad range of disorders. Solution-focused therapy places focus on a person's present and future circumstances, as well as goals rather than past experiences. In this goal-oriented therapy, the systems or issues bringing a person to therapy are typically not targeted. Instead, a qualified therapist encourages those in treatment to develop a vision of the future and offers support as they determine the skills, resources, and abilities needed to achieve this vision. Solution-focused therapy has been used successfully in an individual therapy with both families and couples. Developed with the primary intention of helping those in therapy to find solutions to challenges, the approach has expanded to address issues in other areas of life, such as schools and workplaces. Individuals from different cultures, backgrounds, and age groups have all been shown to benefit from this type of therapy. The effectiveness of this kind of therapy seems to be high, considering it has expanded to reaching other issues in life. The fact that it has reached different cultures, backgrounds, as well as age groups provides great support for the success rate of the solution-focused therapy. The only minor drawbacks clients might experience would be steering away from past experiences and focusing on present and future goals. Majority of therapies are based on past issues and problems, whereas this takes a different approach. Aversion therapy is a treatment grounded in learning theory. One of its basic principles being that all behavior is learned and that undesirable behaviors can be unlearned under the right circumstances. Aversion therapy is an application of the branch of learning theory called classical conditioning. Within this model of learning, an undesirable behavior is matched with an unpleasant stimulus. The unpleasant feelings or sensation become associated with that behavior, and the behavior will decrease in frequency or stop altogether. The goal of aversion therapy is to decrease or eliminate undesirable behaviors. Treatment focuses on changing a specific behavior itself. Unlike insight-oriented approaches that focus on uncovering unconscious motives in order to produce change. The behaviors have been treated with aversion therapy include such addictions as alcohol abuse, drug abuse, smoking, pathological gambling, and sexual deviations. The clients would determine the effectiveness of this therapy and whether or not they match the undesirable behavior with an undesirable feeling. Out of all the individual therapies, I'm interested in learning more about this one. I want to know how they approach the situation as a whole and how they decide what is an undesirable feeling from one person to another. I would be intrigued in also finding out how they choose what affects who and how. And also, I would want to learn the statistics of how beneficial this truly is to every individual they approach. Thank you.